Start.
All right, I'm going to demo this as if we're doing it in the 6 minutes, and hopefully the video is going to finish at the exact same time as well. And I'm going to talk myself through the key points whilst trying to attempt to do it in the 6 minutes for you. So that will be quite a challenge, won't it? So obviously for any of this task, whenever you come in, irrelevant of who the patient is, you pop your PPE on. Any PPE that's there, just put it on. If your PPE does not include an apron, don't put the apron on. If it does, put it on. Next up, I'm going to do the calculation because that's my choice of flow and that's how I prefer to do things. So I'm going to run the calculation in full, although I am aware that some of you have been told you don't need to run the full calculation. If in doubt, practice it, and if worse comes to worse, you don't need to do it when you actually get there. Do you know what I mean? We're going to get clarity, you know who that applies to. So the calculation is body weight times 30 plus 70 for BER, and that equals the total kcals the patient needs for their body weight. So I've been given a scenario of 3 kilos. I also like to write it out in full. I will leave this here for you to check afterwards, just so that then I actually am just filling in my gaps as I go along my calculation. That tends to work the best for me. If you get a bit finger fundled as you're typing it on, as I have right now, just clear your calculator and start again, rather than trying to carry on and you think that it looks incorrect. So once you've done the kcals per body weight, we're now going to just divide it by the kcals per mil that we've been prescribed. All right. So in this case, I've been given 10 kcals per mil. So I would do 160 kcals for body weight divided by 10 kcals per mil. That's now going to give me the total amount of mils the patient needs to get those kilocalories. Okay. So divided by 10. I can keep my number on my calculator, which will help. So that's the mils needed for the total kcals. And then the last step is to divide it by the number of feeds, and I've been given 8 feeds per day. So again, I'm going to do 16 mils, and that is total for the kcals divided by my 8 meals per day. And again, I've left my calculator as it was, so I can just add it to divided by 8, and that's going to give me 2 meals per meal. Nice and simple. Now, I would always recommend rechecking your calculation, but you can come back to that afterwards if you're worried you're going to miss steps, okay, at the end. So, we've got a prepared one. You all have a prepared one to administer, but you have to draw up the appropriate one. For CQ, you have to do the additional step of sterilely drawing up your flush for your syringe. So I'm going to demonstrate that as well, but for them only. So I'm just going to quickly grab some flushes and some meals, she says. Well, I've squirted that on. If something isn't working like that in your real exam, like a squirty syringe isn't giving you surgical spirit and stuff, don't waste the time standing there for ages faffing with it. Just move on to the next thing, you know, because you're just going to let your nerves beat the better of you, that you're focusing on trying to get some surgical spirit out, like I'm now focusing on trying to open a needle. Again, if you've got a needle that's being a bit funny, just find another one. Another one might open easier and better. Make your life as simple as it can be. Think about that time efficiency. Okay, so having swabbed my swab, I'm going to sterilely draw up my flush. Again, this would apply only for that relevant awarding organisation. I'm just demoing it, not resheathing, removing it with what would be a clean sharps bin, and then having that ready to administer. Okay? So having done that for the CQ part, I'm now going to draw up the food. This would where all of you would apply, and we calculated 2 mils. So again, I need to draw up 2 mils of my food. Here we go. Now, because I've drawn it up already on behalf of the CQ sterile, had you been any of the other awarding organisations, you would have drawn up your flush out of a tub labelled flush, okay? But for the purpose of not bothering to repeat myself, because that's just a waste of time, I'm just going to say I have my flush and I have my meal. Now your meal, you leave ready for the examiner to check. So I'm going to pop that there. They would basically check you've drawn up 2 mils and you can read 2 mils, okay? You then administer the prepared one, which ironically for some of you is also 2 mils. So that works out quite well. So let's take our flushes and our prepared and come along to our tube. So for some of you it is a G tube. For the G tube, you are not actually required to flush because it's going straight into the abdomen. So you don't need to put any pressure on any sphincters to push the food down, okay? It doesn't mean to say you can't do it in practice and check patency, but you don't need to. For the esophagostomy tubes and the NO tubes, you do need to flush, okay? For all of the tubes, you either will have a cap that looks a bit like this little red one. This is a cap that is designed to protect air from going in and out of the tube as you do the feed. You don't want to fill anything full of air. It's just going to feel really uncomfortable. So you would, if you don't have one of them, you will be provided with forceps. If you didn't have a cap, you would then use forceps to occlude it. Open, leave, do your feed, camp, open. Does that make sense? So you're making sure that whenever this end is open, that you are actually able to administer the feed to the patient. Yeah, it's capped off so you don't get air going into the patient. Okay? Three-way tap is nice and simple. If it's in line, then it's open. If you were to get seen by one of these, looking a little bit scary. If it's in line, it means it's open. If something's not in line, it means it's closed. All right? So we're going to open. I've got my cap on, so I'm going to unscrew. I'm going to pop that down in my clean tray. I would then connect up my feed, no, my flush, although this is G-tube, you wouldn't need to flush, but I'm just doing it as for all purposes. Open up my cap, so now I know my tube is patent, and I would administer the flush. Now, in terms of speed, this is a really common question. Okay, I would aim to do it at 1 ml per minute in real life, but obviously I'm well aware that in your exam conditions, you don't have a huge amount of time. So you can at that point comment, but they are aware that that's what you're doing. So you can comment, I would give this at 1 ml per minute, but for the purpose of today, I'm just giving the feed. Throughout, you would say that you are checking that your patient is not, particularly for your esophagostomy and NO tubes, that your patient's not coughing, showing any signs of discomfort, showing any signs of irritancy, that you can also see around where the tube is placed, that it's nice and clean, there's no obvious discharge, anything at all that you're worried about, and that you're happy that your patient's responded quite well and hasn't been impacted by the feeding. You can then pop your bits in the waist, which would look like taking your PPE off, and come across to your hospital sheet. So whatever information you're provided with, you can then complete in your complete your hospital sheet in. So you've got Ditsy Carrington. Her daily requirement was 160 kcals, and it's 2 mils per meal. Her total feed today was 2 meals, given all fine. Your initials and today's date, which is the 11th of the 1st, 25. You can check you're happy. In any OSCE task, I always recommend going back over your checklists, using the front of them if you've still got time, if you haven't had an alarm that said, you have got 1 minute remaining, you have got 2 minutes remaining. I would recommend that you then check over your task, make sure you're happy, take your PPE off, and you can leave the station.